Hi there and happy Sunday. Today we're going to be chatting about what exactly to eat in pregnancy. For those of you who don't know me, my name is Jessica Pumple. I'm a registered dietitian, a certified diabetes educator, and a certified bariatric educator. And one of the reasons I started working with prenatal moms is actually working in weight management later, and so many women find that they gain an excess amount of weight in pregnancy, and so maybe they gain weight and then they lose some of it, and then they get pregnant again and then they gain a little bit more weight and then they don't lose all of it, and so it's actually sort of a risk for extra weight later in life. It's also such an important time. We are, the nutrients that we eat are literally growing our baby. So our protein is those building blocks, those amino acids that are growing our baby. Our carbohydrate is fueling our baby's brain and our baby's growth. And our fats are incorporated into every cell membrane that our baby has. And all of the vitamins and minerals and nutrients are helping the proteins. They break down into amino acids and then they build up again to build up your baby's structure and metabolism and everything. So all of the foods that we eat are so important in pregnancy, and we want to be able to give our baby the best start possible. So I'm going to be a little bit nerdy, and I'm going to break down and talk about all the nutrients that we need, and then later I'm going to talk about the foods and what that would look like in a meal plan. And then also, when I'm done the live video, right away I'm going to post a daily checklist so that you can go through your checklist and make sure that you're meeting all of the nutrient needs for you and your baby. Okay, so the first nutrient I'm going to talk about is one of the 3 macronutrients. So I'm going to chat about protein. And so protein, of course, is very important. So I was actually looking it up, and so we actually transfer quite a bit of protein through the placenta barrier to our baby. So we need extra protein, about 38% more protein in pregnancy. And so protein is the meat and alternatives. So it's going to be your meat, chicken, fish, and also beans and legumes, and nuts and seeds as well. Soy products have protein as well. So for protein, the amount that we want to get, so for a healthy person, you can basically calculate how much protein by going 0.8 and multiplying that by your weight in kilograms, and that's the number of grams of protein that you need per day. And in pregnancy, we need an extra 10 grams of protein. So you can either do this calculation yourself, or you could go on an app like MyFitnessPal, and they would use the same equation to calculate the amount of protein, and then just add 10 grams of protein for your protein amounts. So for carbohydrates, again, this is growing our baby's brain, and we want to have more carbohydrates. So we need about 175 grams of carbohydrates each day. So you could look on labels, you could use the MyFitnessPal app and make sure that you're getting in those carbohydrates. The carbohydrate foods are coming from your grains and starches like your bread, pasta, rice, potatoes, and also from your fruit and your milk. That also contains the natural sugars and carbohydrate as well. And you want to choose the low glycemic index carbohydrates. So when we choose the whole grains or beans and legumes, or fruit with the skin on it, or the whole fruit that has fiber in it, or milk is also another low glycemic index carbohydrate, this doesn't raise the blood sugar quite as much, and we're getting more of the nutrients. So for grains, for example, the difference between a whole grain and a refined grain is that they've taken the bran part out of the grain, and the bran part contains that fiber, but it also contains most of the vitamins and minerals. So that's another reason why we want to make sure that we're having whole grains. Canada's Food Guide recommends to have whole grains at least half the time. I think this is because a lot of people are so far from having whole grains most of the time. They don't want to throw people off, but really we want to be, especially in pregnancy, we want to be maximizing our nutrients and having whole grains as often as possible. So more than half the time I would recommend. So all the time or as much as possible, having the whole grains. So fats is the other macronutrient, and when we eat fat, we don't just store it on our body as excess fat, but it actually incorporates into every outer layer of cell membrane that we have. So we have a phospholipid layer on the outside of every cell. So we have the phosphate piece, and then we have 3 chains of fatty acids that are on that. And that depending on the type of fat that we're eating, it's going to be incorporated into our cells. And so we are literally growing our baby with the types of fat that we're eating. And then also for our own cells, our fat changes over every 7 years. And so we have an opportunity to build new cells, new types of fats. And so we know that the healthy fats, the unsaturated fats, the omega-3s, the omega-6s, help our cells function much better, whereas the shape of the unhealthy fats don't help our cells function as well. And so that's why we want to be incorporating more of the healthy fats and less of the unhealthy fats. So especially the omega-3, so that's going to be in your fish, especially your cold water fatty fish like salmon, trout, sardines, as well as vegetarian sources. So we've got, let's see, I have them here. So we've got chia seeds or hemp hearts, flax oil. So these vegetarian sources for your baby, our baby has in, your growing baby in the brain has the capability to turn the vegetarian sources of the omega-3s into the DHA that it can use in its brain. So the vegetarian sources of the omega-3 are still really good sources, and your baby can convert it into a usable form. All right, so calcium is another important nutrient that I wanted to chat about. So our calcium needs during pregnancy actually do increase. So women between the age of 19 and 50 need about 1,000 milligrams of calcium per day, and the needs actually go up in pregnancy. However, the recommendations aren't up because our bodies are amazing and we actually absorb calcium better in pregnancy. So we don't need to increase our amount. However, about 60% of the population are not getting enough calcium in their diet. So Canada's Food Guide has the milk and alternatives food groups to try to get people to have enough calcium. It doesn't have to come from milk. That's probably influenced from food industry, the name of that. But there's milk, and then there's lots of fortified beverages. So you've got your fortified soy, almond, cashew, rice milk that are going to have the equivalent amount of calcium. Of course, there's yogurt and kefir and cheese, nuts and seeds. The dark green leafy vegetables have some. And so you want to make sure that you're meeting your 1,000 milligrams a day. So in a study where they looked at moms who were malnourished and low in calcium, their baby's bone density, when their baby was born, they did a scan and looked at the bone density, was actually lower. And then in the treatment group of this study, they fortified with 600 milligrams of calcium a day, and the babies actually had stronger bone density. So the calcium that we're eating is truly transferred to our growing baby and our growing baby's bones, and so we want to make sure that we're getting that 1,000 milligrams of calcium each day. Okay, so folate, I'm sure that everyone has heard of folate before, is a super important one. So we do want to be having foods that are rich in folate as well before we're pregnant, as well as we want to continue. So sort of the folate it's hard to get enough in sort of the way that we eat, and so it is recommended to supplement this. And so most people will get enough from their prenatal supplement. So the recommendation is 600 micrograms. And so most prenatal supplements have between 600 and 1,000 micrograms of folate. But of course, this is associated with neural tube defects, and so we want to make sure that we're getting enough folate in our diet. So when I think of foods that are high in folate, it's going to be your beans and legumes, your green vegetables, and there's a list of food, nuts and seeds that are high in folate. But you want to make sure that you're getting these foods every day as well as taking your supplement for this. Okay, so the next nutrient that we need extra is iodine. And so now in our society, they've supplemented iodine in most of our foods. So we're not usually low on iodine, but of course we do need about 50% more iodine in pregnancy. So this is something that is also in our prenatal vitamins. We want to make sure that we're taking our prenatal vitamin as well. B6 is another nutrient that we need more of. So we need about 46% more B6. Also, I have read some studies too that in first trimester to take a little bit of B6 can help with morning sickness. And so some doctors are recommending supplementing with a small amount of B6 for morning sickness, of course getting the foods that are high in B6 as well. So specifically the foods that are high in B6, so avocados, baked potato with skin, bananas, brown rice, chicken, especially the white meat, chickpeas, and pork are high in B6 to get as well. Okay. So iron, of course, is another nutrient that when we're pregnant, we have increased needs as well. So our blood volume is expanding and we need more iron to incorporate into this. And so when I think of iron, there's two kinds of iron that you can get. So there's heme iron, and this is going to come from your meat, chicken, fish, and it's absorbed really well. And then there's non-heme iron, which is going to come from nuts and legumes and darkly green leafy vegetables. And even though these foods are high in iron, they're not absorbed as well. So again, most women will get their iron from their prenatal supplement. Unless you're anemic or you're low in iron, it's not recommended to take more iron on top of that. It can make you constipated and not feel well, and it can also inhibit the absorption of other nutrients. So you definitely want to follow up with your doctor if you're worried about your iron levels. But definitely the checklist that I have is going to make sure that you're meeting all your iron needs from the foods that you eat. Okay, so those are the nutrients, but what does that look like in food? So I've sort of taken Canada's food guide and modified it for pregnancy. So the recommendation is to get about an extra, so the first trimester, we need more nutrients, nutrient-dense foods, but not a lot more calories. And then in the second trimester, you need about 340 more calories, and then in the third trimester, about 450 more calories. And so these extra calories, because our nutrient needs are increasing, we want to come from an extra serving of each of the food groups. So for example, you could have an extra, add an extra vegetable snack in, and then you could add an extra piece of fruit, either for a dessert or as a snack. You could add in an extra grain and starch, a whole grain and starch at some point, or have slightly larger portion sizes. And then because our protein and our iron needs are increasing, add an extra portion size of the meat and alternatives. And then also to make sure that we're getting those foods that are high in folate and B6 and all of the vitamins as well, adding in some beans and legumes daily. So whether you're adding a little bit to salads or having some vegetarian meals with beans, trying to get in some of those every day. Nuts and seeds. So I'm not talking a bowl of peanuts here, but sort of the unsalted, especially the dark colored ones. So black walnuts are really high in omega-3, almonds are good, pecans are good. Just getting a variety of the different ones. Brazil nuts as well have lots of magnesium that's important for the baby's growth. I like to include chia and hemp hearts and flax seeds regularly. These are going to be high in your omega-3s as well, so that's on the checklist. As well as making sure that we're getting enough water. So water, because our blood volume is expanding, I know that pregnant women can often feel really thirsty, and it is important to get about 3 liters of water each day. And this doesn't have to be in water. This could be combined with what you're getting in your food, and especially in foods like the fruit and vegetable, there's water in there. But then also we do want to be drinking lots of water as well. So probably about 6 to 8 glasses spread throughout the day is going to get you that 3 liters of water overall. All right, I'm just going to scan through and see that we are good and see if there's any questions here. If you have any questions, you can post them in the comments below, or you can post them later and I will answer them. Okay, I think we are good. Okay, so in the link, I'm going to put it above and below. I'm going to put the link to get your daily checklist. So this is going to be a list. So how many non-starchy vegetables should you have? How many fruit should you have? How much calcium do you need? How many grains and starches? How many protein? How much beans and legumes, nuts, omega-3s, and how much water. So just to make sure that you're meeting all your daily needs and you're growing the healthiest baby possible, you can go and grab that. And I will see you next week. I hope you have a great rest of your weekend. Next week, I'm going to be chatting all about baby-led weaning and introducing foods to your baby. So how to do baby-led weaning, how to do it safely, and some different foods and recipes and options around that. All right, I hope everyone has a great weekend, and I will see you next week. Bye.